one of the most humbling experiences that I have had moving forth over the nearly 2 decades on value-based insurance design is our experience dealing with the U.S. military and the Department of Defense. I had heard that those individuals enrolled in the armed forces and those people who serve at least 20 years, they're enrolled in a health plan called the TRICARE program. And because of budgetary constraints, the fiscal people in the TRICARE program were saying, we're going to have to make our armed services folks, their family members and retirees, pay more for their health care, basically breaking a promise that they would be taken care of in terms of their costs. Luckily for me, a staff member in Washington had heard a line of mine, which is, if you're going to make people pay for something for health care, limit it to the things that they shouldn't be buying in the first place, which is a basic premise of the VBID idea. Good stuff, low cost, stuff you don't need. If you make people pay for them, those should be the things. I had the great honor to be called by Senator John McCain to testify in front of the U.S. Senate Armed Services Committee, where I made a pretty strong plea to say if TRICARE has to evolve to make the military folks pay for their health care, we could use it in this clinically nuanced way. Instead of cheap stuff cheap and expensive stuff more expensive, clinical nuance means the good stuff in the right setting, low cost, and make them pay for the things they don't need. I gave a testimony in February of 2016 and pretty much hoped for the best. Didn't hear anything until the day after Christmas when I got a call from the Senate Armed Services Committee staff saying, oh, Mark, by the way, there's a large VBID demo in TRICARE in the 2017 National Defense Authorization Act. It's already through committee, and President Obama is going to sign it into law before he leaves office on January 20th. So I sit here with goosebumps to think that a general internist from the University of Michigan and his colleagues have put together a concept that has not only made great progress in the commercial healthcare market, is already in the Medicare program with the possibility to expand to all 50 states. But on January 1, 2018, value-based insurance design will be incorporated into the TRICARE program, and some of the 9 million Americans serving in our armed services will have a health insurance product based on a University of Michigan idea.